come instead of waiting for them. So I will just start. Will welcome all the participants. We have some loyal participants who are always there, like Joseph. Welcome everybody, and welcome to you, Dr. Anne Njuguna. Dr. Anne Njuguna is designated occupational
health practitioner
with DOSH. So she's registered with DOSH. She's practiced as a senior resident with Aga Khan Hospital. And that's when she was working in Aga Khan Hospital, that's when I met her in one of our conferences. And now she's founded Ajira Afya. It's you will tell a little bit more about Ajira Afya yourself. So she's the founder and our guest speaker today, and the topic is health and wellness at work. Very interesting topic. And since, as I mentioned, since Saturday was Mental Health Week, so this adds to the discussions we've had earlier on mental health at workplaces and on psychosocial work environment. So this is a good addition to all that. So, Doctor, welcome. The floor is yours.
All right, thank you so much, Abdul. Again, my name is Dr. Anne Njuguna. Designated health practitioner, DOSH certified. I'm also a general practitioner. I've been working in Aga Khan for over 5 years, both in Nairobi and now here in Mombasa. And with all those years, I've developed a passion for wellness and health, particularly in the workplace. And that allowed me to, pursue a postgraduate training in occupational health and safety, and also just to develop. I've developed a passion for health and wellness in the workplace. So today we're going to discuss the aspect of health and wellness, how it is related to work. And so this is the scope of our presentation today. First, I will give some definitions of what these terms are, what is health, what is wellness, what is employment, and from there, discuss a bit about the relationship between our health and our work, discuss a very important topic called what's called an employee wellness program. What are the components of it? What are the benefits to both the employee or to a company or the employer? Then we will change gears a bit and bring it locally. We'll talk about the Kenyan labor laws, particularly what pertains to DOSH and the role of a designated health practitioner. And then from there, I open the floor to question and answer questions from the floor. So I believe you can start. So we'll start off with definitions. So what is health? Health is, according to WHO, is a state of complete physical, mental, psychological, social well-being, and not merely the absence of disease or infirmity. Wellness is an active process of becoming aware of and making choices towards a healthy, fulfilling life. Wellness is more than just absence of illness. Again, it is a dynamic process of change and growth. What is work? Work is any activity where you exert your strength or your mental faculties to do a task. In many times, it is an activity a person engages in regularly to earn a living. Employment, what is employment? It is simply a relationship between two parties, usually based on a contract where work is paid for, where one party could be a corporation, a profit or not for profit organization, cooperative, or any entity where they are the employer and the other person is an employee. So how is health and work related? When as we all know, when an individual has a job, who was maybe jobless and then gets a job, a change happens to them. They become, they are more positive, they have more purpose. You know, their health and their well-being definitely improves when they know they have a job, something to wake them up every morning to go and do. It gives them purpose, self-esteem, confidence, while also rewarding somebody financially, which is a very big motivator for work. Studies have found that an employee can spend up to 80% of their waking hours at their place of employment. I believe this is even many workplaces, workers who can spend even more than that, up to 90%. Therefore, an employee's workplace contributes greatly to their health, and the environment that they work in contributes greatly to their health, and likewise their health will significantly impact the quality of their work. Healthy employees have been found to really have improved productivity, have a better attitude towards their work, have better relationships with co-workers and senior management, and this is a benefit to all parties involved in our workplace. So when we talk about health, over the years, there's an epidemic of lifestyle diseases, diabetes, hypertension, and heart disease and the like. This has developed globally, with unhealthy lifestyles being the norm, such as inactivity, poor nutrition, tobacco use, alcohol consumptions, and very high stress levels in our populations. Lifestyle diseases have shown a marked increase in our working age population. An example of this is diabetes was always thought, type 2 diabetes was always thought to be an old person's disease, but now it is very common in people, men and women in their 30s, even late 20s, even early 20s. Type 2 diabetes has come down and is more of an illness of the youth. And this therefore affects adds to the economic burden through illness-related loss of productivity due to either absence from work, which is called absenteeism, or reduced performance while still at the workplace. This has greatly impacted employee health and well-being and the cost to healthcare coverage. So in response, a lot of employers, both globally and locally, are adopting health promotion and disease prevention strategies, commonly referred to as employee wellness programs. So I am going to just show a few studies. I'm just going to point out a few very important statistics that help to just understand what I'm talking about. Unfortunately, we have very little data on employee wellness programs here in Kenya. So you'll allow me to show you studies from Australia. I have some from America as well, which really show the importance of employee wellness programs, and they can easily be related to our workplace here in Kenya as well, showing its importance also for us. So the first study I'll talk about is Medibank Private, is one of the largest private insurance companies in Australia. They commissioned a study where they took 3,620 employees from corporate and small business. And the conclusions from that study, they found that healthiest employees can contribute up to 143 effective hours per month, compared to 49 effective hours per month by the least healthy. Employees with poor health behaviors have up to 9 times the annual sickness absence of healthy individuals. This is about 18 days in the poor health employees, compared to only 2 days in a healthy employee. A different study assessed the effect of wellness programs on performance. It found that wellness programs, a company that does not have a wellness program is 4 times more likely to lose talent in the next 12 months. And a company or an institution with a wellness program, the percentage of engaged employees increases from 7 to 55%. Creativity and innovation increases from 20 to 72%. A different study they did later on presenteeism. Again, presenteeism is when somebody is at work, but they are not able to perform or do their work optimally because of illness. So the cost of presenteeism to business was found to actually be 4 times that of absenteeism. The average productivity loss per employee from presenteeism was 2.54%, which equates to about 6 working days lost per employee per year. Again, these are the lifestyle diseases that are the common culprit for presenteeism: depression, allergies, hypertension, diabetes. These are generally what contribute to high levels of presenteeism in our workplace. The RAND study, which was a very large, one of the largest studies that has been done assessing employee wellness programs, it was done in 2013. The authors employed 4 different data collection and analysis streams. They reviewed scientific and trade literature. They did a national survey of employers. Sorry, this is in the United States that this was done. A longitudinal analysis was done on medical claims and wellness program data from a sample of employees. 5 case studies of existing wellness programs in a diverse set of employers to gauge the effectiveness of wellness programs and employee and employer experiences. So what they found from this study is that there was statistically significant and clinically meaningful improvements in exercise, frequency, smoking behavior, and weight control. These improvements are sustainable over an observation period of 4 years. 1 year participation in a weight control program was significantly associated with a reduction in body mass index of about 0.15 in the same year, and the effect persisted over 2 subsequent years. Employers overwhelmingly expressed confidence that workplace wellness programs reduce medical costs, absenteeism, and health-related productivity losses. Again, these programs, they concluded that the current epidemic of lifestyle-related diseases was being really tackled very well by the workplace wellness programs, which is the main driver of premature morbidity and mortality in the United States. So what is a wellness program? What can you have in a wellness program? It can be anything from, just doing a blood pressure check on your workers, and it can be, very extravagant. A wellness program is basically tailored to your workplace, tailored to your employees. So some of the components you can have within an employee wellness program is: 1, you can do health risk assessments or surveys. You can do clinical screenings or examinations with focused investigations. This will help you to narrow down and see, what are the things that are ailing your population, what are their current health behaviors, and what is their current health status. And then from there, you can establish interventions. So as part of these interventions, you can have a nutrition and a fitness program. You can set up a lactation program. An ergonomic screening, which is simply an assessment of the workplace to see is the person in the workplace, are they being affected negatively by the way they do their work? Is it the way they're doing their work? Is there any strain to their physical body, strain to their back, into their extremities while they are performing their work? And then giving assessments as how that can be improved. Psychometric testing is more of a psychological examination just to assess people's behavior, and thus adjust their work and their tasks to fit their behavior, their personality, to be able to get the best out of an employee. Other interventions can be smoking cessation if your workers have a high percentage of who are smokers. Smoking cessation program would be efficient. Alcoholics Anonymous would also be helpful. Stress management, this is a very big thing, and mental health screening, a very big issue in the workplace right now. And so this is something that can also be tackled with counseling, with support, and really assisting employees to manage and to build resilience, to build optimism, to allow them to be able to handle the stresses of life and the stresses of work. So what are some of the benefits that an employee would get from an employee wellness program? First thing, they would have an increased productivity in all areas. They would be more productive in their work, more productive in their personal lives, more present, more able to effectively do the duties that are required of them as a person. They would have improved health behavior. When you educate somebody about health, they tend to take that and make positive changes. So making this an active endeavor within the workplace would definitely improve health behavior. Increased creativity, innovation. When somebody is healthy, they are more energetic, they are more excited, and their creativity and innovation levels will improve simultaneously. Employee confidence, sense of belonging in the organization, employee motivation and resilience, reduced absenteeism and sick leave, because the workers will now be adopting healthier lifestyle practices. Then there will be reduced presenteeism and increased engagement at work. You have assisted your employees to tackle their chronic illness, tackle their poor health behaviors, so they will not be struggling to either manage the chronic illnesses that they may have, or predispose themselves to developing those illnesses, because they are now their behavior is a healthy, turning towards more of health. What are the benefits to a company to have an employee wellness program? Improved employee productivity and performance. This is paramount. Any company would want to have employees producing and their productivity optimal. They are present and working and performing at their highest capability. Increased employee engagement. There will be reduced staff turnover. This usually is a big cost to organizations to have employees coming and going on a regular basis. Reduced compensation claims, reduced employer-sponsored health insurance costs, because in most organizations, the employees are under a kind of a medical cover. If majority of your employees are unwell, you will find your insurance costs and healthcare costs as an organization are very high. And so having an employee wellness program tackles that and helps to reduce this overall cost. Of course, for any company, you want to know how is it a return on your investment, because it is an investment when you choose to set up an employee wellness program. So this study, there was a study done, a meta-evaluation of worksite health promotion economic return studies, were huge meta-analysis that was done. Again, this is in the United States. The conclusions from this study was that having a wellness program can reduce sick leave absenteeism by 25%, decrease worker compensation costs by 40%, decrease disability management costs by 24%, and you can save $5.8 for every $1 invested in an employee health and wellness program. A different study assessed mainly the costs and savings that you make from an employee wellness program. It found that medical costs actually fall by $3.27 and absenteeism costs fall by 2.73 for every dollar spent on an employee wellness program. I don't know whether I can continue to the next part of the presentation, or I can take some questions at this point, but I can move forward. Abdul, I can continue?
Yes, just continue to the end.
Right,
and then.
sure. Oh, no problem. All right, so to switch gears a bit, we'll bring it a bit locally. Just what do we do here in Kenya, and what in terms of workplace and health. So the most important thing is to always talk about our labor laws. So we have an OSH Act. We have a Workplace Injury Benefits Act in Kenya. And under the OSH Act, we have 13 subsidiary legislation under the OSH Act of significance to health and safety in the workplace. I will only talk about the Factories and Other Places of Work Act, which is the medical examination rules of 2005. So this is a legislation that simply stipulates it is a requirement of any workplace that exposes its workers to certain hazards. They are obligated to ensure they do regular examinations on their workers and ensure that the workers are safe and are not being negatively affected by the hazards in place. Now, of course, disclaimers with this is that you will find if you look at these medical examination rules, the list of hazards is very narrow. There are very many hazards that are not mentioned in these rules that I believe DOSH is working on expanding this list. Most importantly, the list does not have ergonomic issues, like if you have ergonomic a hazard of ergonomics within your workplace, things like carpal tunnel syndrome, hand vibration syndrome, low back pain, joint pain due to different kind of physical work. This is not included in these rules, and that's a place that things that these rules needs improvement on. So just to show you a snippet of how this list of hazards looks like. So the top one is, the first column is any work involving risk to health. Second column is examination that is required. And then the last column is indication for redeployment and notification to the employer. So the top one is handling animals, any animal products, animal carcasses, veterinary work, laboratory and health work, health workers. So this is required, what is required is a clinical examination as a minimum, both at a pre-employment and annual stage. In all cases of definite or suspected zoonotic diseases is an indication for redeployment. Redeployment simply means that you need to remove that employee from that workplace, either temporarily or permanently, as they are being negatively affected by the hazard. We have arsenic, very big, very important chemical. The list of what is required, you'd have to do, anybody who is exposed to arsenic must undergo annual clinical examination, urinary arsenic content, full chest x-ray, and sputum cytology. And all cases of definite or suspected arsenic poisoning is an indication for redeployment. Radiation, another very big hazard. The minimum requirement for these who are exposed to this is clinical examination. Any abnormal visual and/or clinical sign would be an indication for redeployment. Noise is another very big issue. Audiometric examination is mandatory annually for these workers. Any definite or suspected noise-induced deafness, or a case where the hearing loss there's been deterioration of hearing by 20 decibels or more in 2 successive examinations within 2 weeks, that would be an indication for redeploying this employee from their current workstation. Asbestos, very big, one of the substances that causes the vast group of pneumoconiosis disease. The minimum for this would be clinical examination, lung function test, a full chest x-ray, sputum cytology, both at a pre-employment and annual. A symptomatic worker, progressive deterioration in clinical findings would be indications for redeploying this employee. I've just shown you some of the hazards. There's a whole list that one can always read further. So DOSH stands for the Directorate of Occupational Safety and Health. It is under the Ministry of Labor and Social Protection. Its main functions are to ensure compliance of workplaces to OSH Act 2007, workers' compensation under WIBA 2007, workplace inspection, and implements the National Occupational Health and Safety Policy of 2012. DOSH approves individuals for certification to perform duties on their behalf and report their findings and recommendations to DOSH. So these are air quality monitors, OSH advisors, OSH trainers, fire inspectors, and doctors like myself, a designated health practitioner. So what is a designated health practitioner? This is a medical doctor who is licensed by the director to conduct medical examinations at workplaces on their behalf. We then provide a report to the director with our findings and recommendations. It is guided by the subsidiary legislation that I've mentioned, medical examination rules. This legislation stipulates the role of a DHP and the list of medical examinations required on the hazards and the workers are exposed to, and the frequency they should be done. List of occupational diseases. It's quite a broad list of diseases. This is not even exhaustive. As you can see, there's eye diseases, decompression sickness, which is something we may see more here in Mombasa without in our diverse submarine workers. Ionizing radiation, different types of poisoning. Pneumoconiosis is a very broad chronic lung disease, group of chronic lung diseases, anthracosis, silicosis, asbestos. In our healthcare workers, bloodborne, airborne diseases, and the like. So that is, in brief, my presentation on health and wellness. I am welcome to take any questions, queries, clarifications from the.
Thank you very much, Dr. Anne. This was very interesting, as was expected, and very interesting findings from the research which you reported from Australia and the US, and many other interesting things which as employers, if they reflect on, then they will definitely put in place wellness programs at their workplaces. So for everybody, if we have questions, you can put your question in the chat, or alternative, if you want to speak, let us know, raise your hand, and we can unmute you, and you can speak instead. So this is your chance to put up questions. So while we are waiting for questions from the participants, I made some few observations which would be good if you could expound on this. Maybe put this as questions. You mentioned about the costs of. First, you mentioned about presenteeism and absenteeism. I knew before about absenteeism, but presenteeism it was a new concept. So I've learned about presenteeism, and you mentioned that the cost of presenteeism is 4 times higher than the cost of absenteeism, which means that people being at work when they are not feeling very well is much more expensive than not having these people at work at all. So would you advise managers and supervisors to rather tell people to stay home than to come to work? Isn't it?
I think the matter of presenteeism and absenteeism wouldn't be to say that somebody should stay home, that it is better for them to stay home, but basically it just goes to show that the issue of health is very important, and it affects the quality of work somebody is doing. And so it is in the best interest of a manager and your employer to take your health into consideration when they're thinking about your productivity and your performance. And and I think that it's not really something to say, oh, you should stay home. Yes, of course, especially now in the COVID era, we have been telling everybody, if you feel you have the symptoms, stay home. That's a different situation. But I think the point that is made that is from this is that the wellness and the health of your employees is really something that employers need to take a keener eye on and be more active in supporting employees to be healthy and to pursue health. Yeah.
Okay, thank you for that explanation. I'm looking at the chat for any eventual questions. There are none so far, but I still have some few things. Medical costs go down by $3.27, and absenteeism costs go down by $2.73. This is a lot for every. So we'll say in Kenya, for every 100 shillings invested in wellness programs, you'll have about $6, 600 shillings reduction in cost of medical and cost of absenteeism. Why isn't this something employers are very keen on when there's so much to gain?
First thing, I believe this field of health and wellness at work, particularly in our country, in our part of the world, is something that is not really well known. I've realized a lot of people do not know much about occupational health and safety and do not know much about health in the workplace. It is a field and an area that, there are very few doctors like myself in this field who are actively advocating for health and wellness in the workplace, as opposed to our first world countries where there is extensive research, information, availability of these programs. Here in Kenya, it is very little, very scarce. Like I said, the research on this area is almost nil in this country. I was not able to find any research that has been done on employee wellness programs here. All I was able to find is one or two companies that have taken up employee wellness programs and are reporting very good findings from doing that. Our banking industry, one or two are that. Safaricom is one of our biggest, one of our most admirable companies that is taking up health and wellness in the workplace, doing a very good job. So I would say the issue is a lack of awareness and a lack of understanding on how valuable making such an investment is to an institution.
So when you have companies well established and are not aware of occupational safety and health paradigms and the benefits there, and then we have the informal sector, which employs about 80% of all the workers in Kenya. What will the situation be in this informal sector where there's literally no control at all?
I think that is also another area where you see it's very hard to protect your workers, particularly in the informal sector. It's very hard, and your casual workers, very hard to protect them, and that's where policy and strict legislation is necessary to protect them. Companies, in a sense, would have to be compelled or pushed to do it. Otherwise, a lot of casual workers do some very extraneous work, do very difficult work, very unsafe, unhealthy environments, all for the sake of looking for that shilling. So they basically will agree to almost anything. So it's a very big gap. I feel what would be the best way to tackle that would be with policy, with policy and what legislations we have in place to protect that casual worker, that juakali worker, to make sure that even wherever they are working, they are safe. I think that would be upon policymakers to make to compel people to work to push more for OSH and for safety in any workplace.
If I could just mention, I read the OSH Act and compare it with other legislations of other countries. Actually, the legislation is just as good as anywhere because this is ratification of ILO, and so the legislation is there. and DOSH is there, but something is still missing. That is not happening. Maybe the compelling part should be more of it and more elaborated. But there's a comment in the chat. Thank you, Dr. Njuguna. As a worker, we surely need empowerment in getting an equilibrium between work and health or well-being. Can you comment on that?
I know, I fully agree. I fully agree on that. There is a gap, and as you rightly said, Abdul, we do have the laws in place. They are there, but their enforcement, I would say, would probably be the place where we need to improve. It's a place for improvement. If you know, I can compare Kenya to countries like the UK or America, you know, even right now in the time of COVID-19, they are very strict, very strict standards. You must comply. If you do not comply, you are at risk of being shut down. They will put a padlock on your gate and you will not do any work until you comply with the OSHA regulations. We have not reached that point of you know, being so strict on matters of occupational health and safety in this country. It is a by the way kind of thing, which in the first world countries, they are way ahead of us in this. And there's a lot of room for growth in this area. So I fully agree.
Any further comments, please? Questions, suggestions? Please put them in the chat, and we'll read them as we're going along. In one of your slides, when you're talking about employees' wellness programs, you mentioned lactation programs. What would you put in lactation programs?
A lactation program is any active you know, initiative by an organization to support mothers who are breastfeeding. As you know, there are some organizations that have a breastfeeding room where a woman who has, you know, is lactating can, you know, be able to go there and breastfeed, put her milk in the fridge and such things. So in some workplaces, even a child can be brought to the workplace for the mother to breastfeed the child. Mothers who are newly back to work from, you know, from maternity leave are even permitted, you know, have some more flexible working hours to allow them to lactate. So that is basically what I mean, what is meant by a lactation program. It is an active program that supports women that are breastfeeding and it's in the workplace, yes.
Will you share the recorded session? Yes, the recorded session will be shared once we're done in a day or so. It will be put on our webpage, so it will be available for everybody, and the presentation also will be included together with the recorded session. Thank you for that question. Going back to lactation, I thought first it was about the babies, but then I thought maybe there was more into lactation program where the other workers were involved. But thank you for the clarification.
Yeah. No, it is
It's
just
lovely.
offering a designated area within the workplace that allows a woman who is breastfeeding to be able to express her milk or breastfeed her child if the child can be brought to the workplace. Yeah.
There was something you mentioned about the different diseases, about hypertension, depression, diabetes, and that did you mean they contribute to absenteeism or to presenteeism? I didn't get it clear.
Yeah. So these lifestyle diseases, the allergies, the depression, they do contribute to absenteeism, and presenteeism. Somebody who is struggling with, poorly controlled sugars, or is struggling with depression, and is not well managed on this disease, is going to have a higher tendency of not coming into work, or a higher tendency of coming into work and being completely, distant and not performing or doing their tasks efficiently. So yes, the lifestyle diseases affect a person's, absenteeism, their presence, their ability to come to work regularly, and also their productivity when they do actually come to work.
Now here we are talking about lifestyle and lifestyle diseases and employment. Why does it become the employer's duty to provide situations where counter lifestyle diseases, where the employers chooses to drink over limit? So why does it become the employer's responsibility to put programs to counter such lifestyle diseases? A bit difficult question.
I would say one, like I said in one of the first slides, is somebody spends over 80% of their waking hours at their workplace, and therefore, you want your employees to be able to be productive and to give the best they can at their workplace. So in a sense, you want to get the best out of this employee. So it would be in your best interest as an employer to take an active role in encouraging an employee to be healthy, so that you get the best out of them. I read in one article, they mentioned that we do all these things for our employees, but we give our employees medical cover, pension cover, optical, dental. If you're very lucky, you have an employer that gives you optical and dental cover. All of these things are given to employees, not because it actually gives such a big return in terms of more employees staying with the job and them being the higher chances of them being retained, but because it is ethically right to give somebody some basic benefits to encourage them to do a better job. We don't do it. We do it just to kind of encourage and to make somebody feel appreciated, and to make somebody feel like they are valued employee. So another step forward is employer who takes an active role in the health of their employees. I think it's something that you do to foster a good working relationship with your employers. After all, you have a contract with this person. You would want them to be.
You are.
I don't know that that's as.
Yeah, you're at the end. You are breaking up a little bit, but I think it's it's a very good, very good answer. That you get trying to make your employees healthy. It's their responsibility to be to make sure that they are healthy themselves, and you encouraging them to be healthy and to live healthy lives. That's a very good way to put it to employers, that you contribute to making your employers healthy. Well,
yeah, the last part, I think the part that probably you didn't hear was I was simply saying that it's a relationship you develop with your employee. As we have said, an employment is a contract between an employee and an employer. When you're having that kind of a relationship, you would want the person you are in this relationship with to be happy, to be able to give their best, and it's kind of a back and forth. You want more from your employees, so you would give more and support them more, so that you get more out of them.
Thank you for that very good clarification. We have some a few minutes for this session. While we are waiting for additional questions, I want to inform you that the next webinar will be on 26th of October, 2 weeks from today, and we'll have Mr. Sanjay Gandhi from Current Technologies, who will talk about overcoming OSH management challenges. So another interesting webinar that will be on 26th of October with Sanjay Gandhi. Maybe some of you know Sanjay. Any further questions from the audience? I have one more thing where you mentioned that without wellness programs, a company is more likely to lose talent in next 12 months. Maybe this was a study from the Medibank study, I think, from Australia, or the other study. But how will you translate this into Kenya's situation?
I would say, one is, disclaimer is these are studies that have been done in another country where the dynamics are different, the workplace is different, the culture, the workplace culture is different. So, we look at these studies when we take it with a pinch of salt, because it is not something that we have done locally. But I believe in general, when you implement it, basically the point is that when you implement a wellness program and take your employees' wellness into, or you fail to do so, the employee will probably feel lack of a sense of belonging, would probably be looking for a better option, a better kind of work environment, a better deal, so to speak, to feel valued and important to an organization. So you would find them more likely to leave when they don't feel that they are appreciated. People like to feel appreciated. I believe that is across the globe. So I would say that is what I would say, is that's what it translates to. If somebody does not feel they are appreciated in a workplace, and there is nothing really implemented to support them and to help them to be their best selves, and they're more likely to look for something else.
There is a comment here about encouraging breastfeeding, and yet there may be challenges at workplaces like having a separate room or very busy shift, long shift. And it is suggested therefore that maybe the employers should consider shorter working hours for the breastfeeding mothers to avoid complications. And of course the situation of the workplaces. So instead of looking for solutions like having extra room for breastfeeding, that the shift should be shorter, or shorter working hours.
I think just to add to comment on that, like I said, one of the companies I admire very much on their support of parents and mothers, particularly Safaricom, and they actually assist. A mother is actually given 6 months of maternity leave. They don't give the 3 months as is the law. And also they have the mother, once they come back, they are given another 6 months of light duties. So they can come in at 11, leave at 3 o'clock for the next 6 months. So for a whole year, a mother, or even the father, even the male, the father, is given a lot of leeway to support them in their home life and in with their raising their child. So that's a very special situation, but it's a good example to just put out there.
Thank you very much for that wonderful presentation and for the discussion. I can see there are no more comments in the chat. There are no more questions. So this is your last chance to put the final question in the chat box. Otherwise, I would like to take this opportunity to thank you, Dr. Anne Njuguna, for this wonderful evening, this good presentation on wellness programs and what wellness programs can do for the companies and for the employees, because this is win-win for everybody if wellness programs are. Dr. Anne Njuguna is, as I mentioned, is a founder of Ajira Afya, so you can contact Aha, the contact information is there. You can see it, and of course, when the recording is put on the website, you can review it. You can pass it on to your friends, and you need advice on wellness programs. I'm sure Dr. Anne will be glad to help in that field. So if there's no more questions, no more comments, I would like also to thank all of you participants for your active participation, for taking part in this webinar this evening. And we welcome you again to the next webinar on 26 with Sanjay Gandhi on yes. Well, having said that, I think I will call an end to this webinar for now. And Dr. Anne, we hope to hear from you again in another webinar, hopefully. And maybe someday you come to our physical conference and make presentation there also. So thank you, everybody. Have a nice evening, and God bless you all.